Are you thinking about getting lengthening done with an internal nail but not sure which one to choose? Well, no worries, because we're going to break down the different nails available, including the PRECICE, FITBONE, BETZBONE, and G-nail to help you decide which one's right for you. What's up guys, Victor here, and today we're going to be talking about the various internal lengthening nails available and which one you should choose for your surgery. If you've been dabbling into the world of lengthening for any amount of time, you might be familiar with the different types of nails on the market, including the PRECICE, FITBONE, BETZBONE, and Goucher or G-nail. Each of these nails have unique features, and choosing the right one is crucial for successful lengthening. So let's delve deeper into each of these nails and figure out which one's best for you. Okay, so I made a little chart with different categories to make it easier to compare and contrast different lengthening nails on the market. And I know some people will ask about LON, which stands for lengthening over nail. And my response to that is that it's technically not a lengthening nail, but rather an external fixator with an internal trauma nail for fixation, so it's not included here. And although there were a few other obscure nails out there on the market, they're not nearly as popular as the Big Four and hopefully soon be Big Five. All right, so starting us off, we have the PRECICE nail. It's a magnetic lengthening nail that uses an external remote control to distract the device at the designated rate. This gained a lot of popularity because it allows the surgeon to monitor and adjust the patient's lengthening process with precision, hence the name. It has had several iterations since it first broke onto the scene in 2011 with version 1, which your boy had, and it's currently at 2.2 and would be at actually version 3 with the stride nail, but that was removed from the market in early 2021. Now there are talks of a new weight-bearing nail which will replace the stride, but we're just gonna have to wait and see. All right, so what's the size of this thing? Well, the PRECICE comes in 3 sizes: small, medium, and large, which are determined by the diameter of this nail so they can fit properly into the canal or inside of your bone. The small is 8.5 millimeters, the medium is 10.7 millimeters, and the large is 12.5 millimeters. How does it work? Well, the interactions between the magnet inside of the nail and the device, the ERC, allow for the ability to turn the magnet and distract the device, meaning lengthen or retract or reverse lengthen, which is a huge benefit because it allows the surgeons to have more control over the patient's lengthening rate and even go backwards if they get into trouble and the bone regeneration isn't sufficient. The PRECICE nail is made out of a titanium alloy, and that kind of relates to its weight-bearing capacity, right? Because it's less than the stride, which was made out of Biodura 108, which is similar to stainless steel. So that kind of shows that the PRECICE is not a full weight-bearing nail like the stride was. All right, next up is stroke length. How much length can you get from the nail? Well, the PRECICE can lengthen 80 millimeters or 8 centimeters, which is 3.15 inches. What about weight-bearing capacity? Well, for the small, you can get up to 30 pounds per nail. The medium has a capacity of 50 pounds per nail, and the large, 75 pounds per nail. What does that mean? Well, basically, let's say that your body weight is 120 pounds, and you get the largest diameter nails, which can hold up to 75 pounds per nail, which is 150 pounds. Can you walk? The answer is no. You still need walker for walking assistance. However, you could technically stand without holding on with both feet flat on the floor, but it's still recommended just to always use your walker. But the thing is that you have a greater sense of security because you are under the capacity of the nail. All right, next up is the FITBONE. The FITBONE is an internal nail powered by an electric motor, and it was developed by Dr. Baumgart in Germany in 1997. Now, since it arrived before the PRECICE, it was a major innovative design compared to things like the ISKD. And since then, it's had several thousand successful implants, and that's probably the reason why it's still around today. It can be used for both the tibia and the femurs in either an antegrade or retrograde fashion, much like the PRECICE. Size-wise, there are 3 different sizes: small, medium, and large. We have a 9 millimeter, 11 millimeter, and 13 millimeter, which are very much like the PRECICE nail. So mechanism-wise, it has an electric motor, but no battery. Similar to the magnet in PRECICE, the motorized drive is hermetically encapsulated, and it doesn't have any contact with the outside environment of, being inside your leg. The motor has a small cord with a receptor that's placed underneath the skin, which receives power from an external transductor to allow for the distraction of the nail. So it's pretty complicated, but you can kind of see it down here. Actually, I put a little picture of it. So this little cord, this little receiver is placed underneath the skin, and then there's kind of like a big device that kind of goes on top of that over your leg, and then it hits and gives it power. All right, so the FITBONE is made out of stainless steel, and the stroke length, it can give you the same as the PRECICE, 80 millimeters or 3.15 inches. Now, weight-bearing capacity, this was kind of hard to find online. Based on what I found, it's between 40 and 60 pounds from the small, medium, and large, like 40 pounds for the small, 50 pounds for the medium, and 60 pounds for the large. So pretty comparative, not full weight-bearing, but a decent distractive. What about feedback? Well, many surgeons have used the FITBONE for many years, and they were happy with the results. But I only know about 10 patients who've recently used the FITBONE, and they seem pretty fine with it, much like the PRECICE, no serious complaints. It did the job. However, there were about 2 that had issues, but one of them might have been the patient's fault, but it's kind of hard to say. All right, next up we have the BETZBONE, which is a mechanical internal lengthening nail developed by Dr. Betz in Germany. It's a derivative of the Albizia nail, and since then it's had several modifications. Size-wise, it has 4 different sizes based on the interview that I did with Dr. Betz, a 10, 11, 12, and 13 millimeter for different bone canal sizes. What about lengthening mechanism? Well, the BETZBONE uses a manual ratcheting mechanism called clicking that happens from a rotation of the leg back and forth. It's pretty much like a manual torque of your leg to initiate the distraction of the device. The BETZBONE was originally made out of a surgical stainless steel, but it's now cobalt chrome inside and out, which means no encapsulation needed and thus no corrosive effects. All right, stroke length. How much length can you get from this thing? This can give you 124 millimeters, not sure why I put 125, which is 4.92 inches, just under 5 inches, which is crazy. It's 50% more than the PRECICE or the FITBONE. Now, patient responsibility is highly important here because you don't want to over lengthen and develop a severe muscle contracture, so you need to kind of listen to your body and lengthen and observe. What about the weight bearing capacity? Well, due to the durability of the metal material, this nail has full weight bearing capacity, which is approximately 150 pounds per nail. So that means that you can get right to your feet right after surgery. You should still use walker and walking assistance to kind of like make sure you're stabilized. But the nice thing is that it gives patients a really good sense of security that the nail will not malfunction. All right, so what about feedback? Well, it's only used by the surgeons at the Betz Institute, so obviously the surgeons there are going to give it high praises. Well, the patients also seem to enjoy the immediate mobilization advantages of this implant over other nails. However, some do mention that the clicking mechanism has a bit of a learning curve, and it can produce some, discomfort when you're distracting, around that bone regenerate site. All right, finally we have the Goucher or G nail. And much like the BETZBONE, it's also a mechanical internal lengthening nail that was developed by Dr. Goucher and Paul Gramont. It's also a derivative of the Albizia nail, and it's had several modifications since. Size-wise, there's 3 different sizes, an 11 millimeter small, 13 millimeter medium, and a 15 millimeter large nail for the different bone canal sizes. Again, really robust here because it's a weight-bearing nail. So the G nail is made out of stainless steel and cobalt chrome based on what I found. And so just like the BETZBONE, there's no corrosive effects. Stroke length is 100 centimeters, or actually no, 100 millimeters. Not sure why I put that there, messed up, typo. So 100 millimeters, which is 10 centimeters, which is 3.92 inches, which is just under 4 inches. That's crazy, still a lot of length. But again, you need to use patient responsibility here. You need to know your body's limits so you don't over lengthen. And finally, weight bearing capacity. Just like the BETZBONE, it's a full weight bearing capacity nail. Again, caution should always be used. Feedback-wise, it's only been used by the surgeon inventor, Dr. Goucher, and as of late 2021, Dr. Gagiotakis in Greece has also started to use it as an alternative weight-bearing option for patients since the Stride was recalled. Now, the patients have a similar experience to the BETZBONE. They like the speed to their feet, but again, the clicking mechanism is a learning process. All right, so which nail should you choose for your lengthening? Well, I say that you pick the one that's best for you. And which one's that? Well, it really comes down to 2 main factors, right? It's gonna be lengthening mechanism versus weight-bearing capacity. And for me, the nails with the most efficient and painless lengthening mechanism are the PRECICE and the FITBONE. And the winner from these 2 are gonna depend on patient feedback and malfunction rate. And based on what I've heard, there were a few more issues with the FITBONE, and you have the ability to reverse lengthen with the PRECICE nail should you get into any trouble with quality bone regenerate. You could just use the accordion technique and hopefully get yourself out of trouble. So I would say that the PRECICE wins here. And when it comes to weight-bearing capacity, you have the G nail versus the BETZBONE. Both are very comparable here because they're both derivatives of the Albizia nail, but again, it's gonna depend on patient feedback and malfunction rate. And based on what I've heard, the G nail had a few more issues with some patients that were doing lengthening with it, and so that means that the BETZBONE edges out the G nail here. So if I were to go further, then it's gonna be the PRECICE versus the BETZBONE. And now you have to decide what's more important, weight-bearing capacity or lengthening mechanism. And that I leave up to you. But comment below, which lengthening nail are you most interested in for your lengthening surgery? Any of the big 4, or are you planning on waiting for the successor to the PRECICE nail with more weight-bearing capacity? Comment below if you found the video helpful, hit that like button, be sure to subscribe, and until next time, this is Victor from Cyborg for Life, signing out.